Hi, I'm Rosie Bain and this is a presentation on human immunity. I'm going to be covering the first, second and third lines of defence, self-recognition and tolerance to own tissues and rejection of transplanted organs, immune system disorders, categories of acquired immunity, immune response to vaccination and immunological memory, the benefits of vaccination, concept of herd immunity and vaccination programs, and finally factors affecting vaccine uptake. So our first line of defence consists of physical and chemical barriers, including the skin, mucous membranes and the urogenital tract. Now, a skin, quite an obvious one. It's a physical barrier. It's like our natural armour and it's a very effective barrier against pathogens so long as it's intact. The mucous membranes are like an interface between the outside environment and inside our body. These line the surfaces of the eyes, ears, sinuses, nose, mouth and throat, as well as the gastrointestinal, respiratory and urogenital tracts. The mucous membranes form secretions to protect against infections, so these may be acidic or alkaline conditions to make a more of a hostile environment for infections so that they can't survive. They also have ciliated cells to trap and remove foreign particles and bacteria. The lining of our intestines has a particularly important in our immunity as well as our digestion, just as a side note. Now the urogenital tract, these are pretty much the same for men and women. We've got the kidney, ureter, bladder and the urethra. The urethra is just a bit longer in the male and this helps protect the bladder from infection because the regular passing of urine from the bladder washes out pathogens from the body. For women, secretions in the vagina form lactic acid and this helps to inactivate potential pathogens whilst also maintaining protective and helpful bacteria. Now for our second lines of defence. Inflammation. So if we get an infection or are injured, there'll be an inflammatory response which is triggered. And this allows the blood vessels to dilate so that more blood can get to the area to help fight off any infection. There'll also be a rise in temperature in the area which has an antibiotic effect. Then there's phagocytosis, and this is where the white blood cells ingest foreign substances. And finally fever. So when we get ill we might burn up, get very hot, and this rise in body temperature makes it harder for bacteria or viruses to survive. So the first and second lines of defence are non-specific, so this just happens where the immune system picks up that there's an infection and will just fire sort of non-specific responses. Whereas our third line of defence is when the body creates a specific response to a pathogen. So we develop what's called acquired immunity, and this is where the body learns to develop specific responses for different pathogens. We have antigen sensitivity. So antigens are a component of a pathogen that tells the body it's being attacked. And when this happens, the body can then produce immunoglobulins or antibodies. And these are proteins that bind to the antigens to target the infection to help fight it off. Now we have two very important players in our third line of defence. We've got the T cells and the B cells. So the T cells destroy foreign substances, and we have something called cytotoxic T cells, which release perforin into the infected cells, literally punching holes in them to defeat them. And they also release enzymes to destroy the structure of the cell in the harmful cells. B cells are like messengers. We have antigen presenting cells which present antigens to T cells. This is to signal for the T cell to get active and fight off that pathogen. And the B cells are also what produce the antibodies. Self-recognition, tolerance to own tissues, and rejection of transplanted organs. So, antigens allow the immune system to distinguish between self and non-self. So, we just covered that antigens are the component of the pathogen that lets us know we're being attacked, but our own cells also have antigens. So it's really important for the body to be able to distinguish between self-antigens and harmful antigens. When this self-recognition mechanism falters, signals are given for the body to attack its self-antigens, causing an autoimmune condition. So I'll give you a couple of examples of immune disorders or autoimmune conditions. So a fairly well-known one is rheumatoid arthritis. This is where antibodies are sent to the joints, causing quite a painful inflammatory response in the synovium, which is the fluid in the joints. And this releases damaging chemicals to the surrounding bones, cartilage, tendons, and ligaments. If this is left untreated, these damaging chemicals can eventually destroy the joint completely. Rheumatoid arthritis is incurable, but it can be managed with disease-modifying anti-rheumatic drugs, or also known as DMARDs. Another condition is lupus, which is also a condition with inflammation. So causes inflammation but can have varying symptoms with different degrees of severity. It can cause skin rashes, sun sensitivity, and also inflammation of the organs, so the heart, lungs, kidneys, as well as inflammation of the joints. Most people with lupus will experience some fatigue, and it can be managed with hydroxychloroquine and anti-inflammatory drugs. In severe cases for these immune disorders, immunosuppressants may be used to help lessen the symptoms, but then of course that will have the effect of lowering the immune system. So now we're going to look at the rejection of transplanted organs. So this is an interesting one. So if somebody's organ is failing and it needs replacing, they'll need a donated organ from another person. But there'll always be an element of rejection when this occurs. So when transplanting one organ from one person to another, they have to minimise this rejection to make it successful. So one of these things is tissue typing, which is finding a close biological match. So somebody with the same blood type is often a consideration. Although the match will be close, it won't be perfect unless the donor and the person receiving the organ are identical twins and share the same DNA. As well as tissue typing, also monoclonal antibodies will be used during and after the surgery, and the purpose of these is to block specific T cells to stop them from destroying the foreign tissue. Tissue typing and monoclonal antibodies are essential for organ transplants to be successful. Now I'm going to go back to acquired immunity, cover this a bit more. So there are two types. We have active immunity and passive immunity. So active immunity is acquired when a person themselves is exposed to a pathogen. So when that person is exposed to a pathogen, the B cells will create antibodies to kill it off. And this can be natural, so if the person just naturally catches that disease and their body learns to fight it off and hopefully survives it, or it can also be artificial, so through vaccination. Active immunity can take weeks to develop, so it takes a while for the body to learn, but once it has learned how to fight it off, the response is long lasting because we have something called memory B cells, which will stay on standby in the lymph nodes for next time the pathogen is encountered. So as we can see here, just to give an example of how the antibodies look, they have these little shapes that will just fit perfectly around the antigen of the harmful cells so that it can latch on really effectively. So with passive immunity, this is when the antibodies are passed directly into a person. So mostly this is from one person to another, so either through the mother's bloodstream to the fetus when in utero, or through breastfeeding after the baby's born. These antibodies can also be artificially induced through an injection, but that's not quite as common. And the thing with passive immunity is it gives immediate protection, so the person receiving the antibodies will be immediately protected from whichever pathogens those antibodies are suited for, but it's only short-lived. It only lasts from a few days to a few months. So the person will eventually need active immunity. And a way of doing this is by giving vaccinations. So I'm going to talk about the immune response to vaccination now. Vaccines contain a weakened or dead pathogen. So this means that there will be the antigen present to let the body learn how to fight this pathogen, but without it making that person very ill because it is inactive. The presence of the antigens will stimulate an antibody production from the lymphocytes, which are a type of B cell. So this develops what's called immunological memory, and this means the next time that the body comes into contact with that pathogen, the immune response will be much faster and more effective. So there are two responses. There's the primary response, so that's when the body is first introduced to the pathogen, so the immune system's learning how to respond and taking time to create the correct antibodies for that pathogen. And then there's the secondary response, which is more efficient because the B cells will quickly recognise the pathogen and bombard it with antibodies. And this can be the case even years after the primary response because of the immunological memory and those memory B cells on standby. So to highlight the benefits of vaccination, we're going to look at measles infection rates between 1940 and present day. So data published by the UK Health Security Agency shows an overall dramatic decrease in measles cases and deaths. The annual number of deaths declined from several hundreds before 1952 to almost none in 2020. Almost none because they were very, very rare in that case. And all those reported deaths occurred in unvaccinated individuals, some of whom had underlying immunological problems. So just going to take a look at a graph to kind of highlight how much these cases decreased. So we can see up until 1968, which is when the vaccine was introduced in the UK, there are some peaks and dips, but overall there are some quite high numbers of measles cases there. Whereas this line here, when the vaccine was introduced, again some peaks and dips, but the overall trend is that the number is decreasing dramatically. And this happens because of herd immunity. So the concept of herd immunity and vaccination programs is that contagious diseases are spread from person to person quite easily. So if there's a whole community of people who aren't protected against a disease, it will spread really quickly, really easily. Whereas if the majority of a community are protected, that disease can't spread as easily and will pretty much remain contained if somebody does catch it. For herd immunity to be achieved, there's a threshold for the required percentage of the population to be vaccinated, and this threshold is quite high. For measles, it's about 95%. So 95% of the population has to be vaccinated for herd immunity to be achieved. And yeah, so if we look here, this just illustrates quite nicely how herd immunity works. So all the people in grey are people unvaccinated, blue people are vaccinated, and then we've got people in orange who are infected. So we see here, I've got one person infected here and only a few vaccinated people, the rest are not protected. So if that one person has it, you can see it spreads really quickly to all the people surrounding, and then eventually everybody except those who have protection are infected with the disease. Whereas if we see here, most of the community is protected, they have been vaccinated, with just a few who haven't. So if that same person gets infected, it can still spread to those who are not protected or vaccinated, but it will be very limited because it can't really spread from person to person because most people are protected. Now, the factors affecting vaccine uptake, there are a few. One of them is illness, so sometimes a vaccination isn't recommended to people if they're already recovering from another illness or if they've had a previous allergic reaction to a vaccine in the past. Another is concerns over the possibility of disability or even death caused by a vaccine. This can happen, but it is extremely rare, and it's maintained that the benefits of vaccination far outweigh the risks. There's also a lot of misinformation out there. So there's the anti-vax movement, and this has also fueled the use of internet trolls and bots to promote negative messages and kind of mislead people in what they believe. So those are the factors affecting vaccine uptake. There's also lack of trust in governments and healthcare systems for various reasons. So to summarise, we looked at the first, second and third lines of defence, self-recognition, tolerance to own tissues and rejection of transplanted organs, immune system disorders, categories of acquired immunity, immune response to vaccination and immunological memory, the benefits of vaccination, and the concept of herd immunity and vaccination programs, as well as factors affecting vaccine uptake. Okay, thank you very much.